Hey everybody, my name is Chet Donnelly. I'm a spine surgeon in Dallas, Texas, and today I want to show you what it looks like in the operating room when you roll in for a spine surgery. So this is a very fancy operating room I'm in now. I'm going to show you some of the things you can expect when you come in here to make you a little more acclimated for maybe the anxiety that you likely are going to be having when you have any surgery, particularly spine surgery. Before we get to the operating room, you have a preoperative holding area. So this is one of the bays or stalls in the preoperative holding area where patients will be kept. It's at this place they'll have vitals done, have an IV placed, and down this hall over here is the doors that lead to the operating rooms. So this is the hallway outside of the operating rooms, the scrub tanks where we'll kind of wash our hands for surgery, and then this is the fancy operating room. And I'll go through this in a lot of detail, but essentially you see the anesthesia table. This gives you a general look of things you'll see when you first get in there. It's a lot to take in, and I'm looking forward to going through each individual thing over the next several minutes in this video. Now look, this one applies specifically to spine surgery. I'm gonna have other videos in the future talking about other surgeries. Okay, so once you enter the operating room, the bed will be positioned right about here in terms of the stretcher. Your anesthesiologist will be up top here. They'll stop playing Sudoku, and at this point, they'll start helping kind of get everything going. Once you get intubated, the team will roll you over to the bed. Now, in certain surgeries, we have you scoot over to the bed, and you get intubated in this surgical bed here. So we have different things for the lines. This helps monitor blood pressure, give medications during the surgery. In spine surgery, we have something called a neuromonitoring technician. The one I have is what I think is the absolute best in the world. She's gonna be monitoring the patient's brain, nerves, and helping us during surgery. She's a vital part of the case. She'll have all of her equipment hooked up here. And as you can see, there's gonna be a bunch of needles, and this is a spine surgery, that go into the patient and helps us watch all of the nerves during surgery in real time. The next thing you'll see up here, I don't have it pulled up for patient privacy, but it will be the x-rays and MRI of the patient. We have these on giant, huge screens here, so that way we can see exactly the pathology that we're treating, also in real time. In this area here, and I'll show it later, will be our x-ray tech. They'll be shooting x-rays during the case. And just like that, there it is. So we call it a C-arm because it looks like the letter C. It's a fluoroscopic imaging machine. Essentially, it shoots x-rays during surgery, so it shows us where we are during the case. We have these screens behind us, so we're shooting x-rays during the case. And we can look at these screens during the case to see exactly where our hardware is, where the metal is, where our decompression is. That's for spine surgery specifically. And then over here we have our surgical table. Now the surgery we're about to do here is a one-level neck fusion. So not too much equipment. We do these pretty minimally invasively. The surgical tech has already set up all of the equipment for this case. We have our sterile gowns ready to go. This one called Flow Seal, helps with coagulation. And we'll have the different trials and implants that the rep will bring, and that's what gets inserted into the neck. Back here is one of the nursing stations. This can be what's called the circulator. There's things we need during surgery. They're charting, getting a lot of things done that are very efficiently needed during surgery. Looking up here, this is a very fancy OR. We do a lot of complex scoliosis cases, and you can see the ceiling is actually made for this type of complexity. This is a special type of x-ray machine that's hanging down from the ceiling. That way, during the surgery, we can move it over the patient, over the field, and we can see exactly the patient's correction of their curve and scoliosis in real time over on this computer here. Another one of the high-tech tools we use day to day in our surgical field. So again, here's kind of a bird's eye view of the room when you're laying down. You'll be looking just like this. Now I'm going to go show you a couple other ORs just to acclimate you with the general sense of what an operating room looks like. So again, it's kind of the same general idea. There's a door, there's a bed. You have the table where they set up all the equipment. That's a 4-post jacks in there for spine surgery. All the equipment's on the back wall, and it's a great high-tech place to take care of people. After surgery, you'll wake up in the post-operative care unit. This is where they'll be checking your vitals, helping you wake up, controlling your pain medicine, and eventually you'll either be getting discharged home from here or they'll be sending you upstairs to the inpatient holding area. So look, surgery is scary, having an operation is scary, going to the hospital is scary. Hopefully this video shows you some of the things you can expect, gives you a little more confidence about the surgery you're going to be having, If you have additional questions, please write them below in the comment box. I'd love to see what everyone's talking about.